Hi and welcome. We are privileged to be in the offices of Utah Valley Hospital, and as you can see, sitting next to me is the President and CEO of Utah Valley Hospital, Kyle Hansen. We had a chance to visit here over the last couple of months leading up to our event today, and one of the things I just want to share as we get started, Kyle is a gentle giant. When we had been visiting for the last, gosh, how long has it been? 10 months that we've been on Zoom calls. Yep. Not meeting Kyle in person, and we finally met up with him a couple of weeks ago. I was taken back at how tall he is. It's more than just his height. He's tall in his experience, and he certainly is tall in his care for this hospital, its patients, and the staff. And so we're privileged to introduce Kyle on our chamber chat here, and I have a few questions just to kind of get things rolling here, but I got to think that there were various phases of the pandemic as it related to, moving through the different decisions that had to be made. Each month seemed like we were presented with a new sort of challenge and opportunity. I imagine that in your role, you had to manage that as part of the pandemic, right? Not just the disease itself, not just the virus, but the information. How did you, and you did it, in my opinion, fairly adeptly. I mean, I saw you on the news for all good reasons, and even you mentioned a couple of times how you had to dispel and debunk some myths.
Yeah. Boy, that's been a real challenge. I think it continues to be, and I guess one of the principles that it sort of brings up in my mind is, as a leader, I've always, and I've been taught by mentors and others that I look up to, that it's really about, especially during difficult times, it's really about taking on issues and not people. And I feel like over the last couple of years, there's been too much of us, taking on people instead of trying to really get down to a debate of ideas around what are the issues, because they get lost in the emotional, visceral reaction that so many people have to that. We struggled with the management of information with our teams, I think, as well. I mean, thankfully, we were able to get a majority of our staff access to the vaccine pretty early as that rolled out. And I think that created a sense of relief and calm almost with our teams, where not everybody's taken it, even to this day. It's not been mandated or required in our company. But we tried to provide information that we knew was trusted, scientifically backed and based information so that our caregivers could make an informed decision. And to me, it was really telling that sort of the, somewhat the top of the food chain in terms of the healthcare world, the physicians, we had extremely high levels of adoption of the vaccine with our physicians, right? That had a huge impact on some of our other caregivers here, because many of them work closely with these physicians, and again, they're all trying to process the information that's available the same way. And as they saw some of their colleagues, physician colleagues making decisions to get it, we know that had an impact. So we tried to make, objective, scientifically based information around what was happening, whether that was related to the virus itself or access to the vaccines available, through our own internal channels in a way that our staff could digest, but still make a decision for themselves. And, I don't know if it was perfect, but I feel like we did a decent job. And then, the other side of that coin is trying to manage the information externally to the community about what's going on. So, had the opportunity to sit with the city council and others through the pandemic and try and explain, this is where we're at. This is the number of patients we have in the hospital with COVID at the time. These are our challenges with treating these patients and how long they're staying, and just so much information that's out there that's, hearsay and not backed on by what's actually being experienced at the local hospital. And I think, as I mentioned in that one meeting, we've had individuals who, didn't trust anything, and were going to try and view for themselves what was going on in the hospital, even though we were, restricting visitor access and things. And so just tried to use trusted sources of information based on, we're a healthcare organization, and so we're always going to be looking at the scientific literature and information that our clinicians trust, and use that to try and help people to make informed decisions. So.
I love that. It sounds like you've got kind of a long view, and you should, because you're just now at the point in your career where you are picking up major strides. You have another solid 15, 20, 25 years left. What's left undone? Because there's still a lot of time ahead.
There is, and that's a great question. I think when you're ambitious and you're kind of always looking up to try and get to a certain place professionally, when you finally arrive at what you sort of set as a goal or a professional idea of where you wanted to land professionally, and you get there, it sort of starts to become, well, have I made enough difference? I think for me professionally, I do have a fair amount of time left to work, and working in a setting where people are giving care in their community is powerful, and it's neat to be a part of that. But as I look ahead, there are chronic problems with our healthcare system in this country, and we're not insulated from that here in Utah. While we have some of the lowest costs of healthcare in the country, in this state, it's great. I don't run into anybody that says to me, "Man, healthcare's so affordable. It's great. I got this bill for my hospital or for my doctor," and you don't hear a lot of that, right? So I think with the time that I have left, I really want to see us make measurable improvement in making healthcare more affordable. Healthcare in this country is consuming nearly 20% of our GDP, right? One out of every $5 almost to this point is being spent on healthcare. That's just too much. It's way too much. It's bankrupting government, and it's very difficult for our business community to continue to swallow increasing healthcare costs. It just can't continue. So I'm not sure what role that will be, if it will continue to be in a hospital setting or somewhere else, but I guess my hope with the time that I continue to have left to work is I want to see us make a measurable impact that everyday people in our community feel in terms of the cost of healthcare being much more affordable.
Yeah.
So.
As we wind down here, and we've talked about Utah Valley, we've talked about how our two organizations actually share a name, Utah Valley Chamber, Utah Valley Hospital. Right. The principles that you talk about, which ones do you think we need to hang on to get to the next 20, 30 years with as much success and prosperity and the attributes that you used with excellence and integrity that are going to get us to the next, by the time our kids are now having kids?
Yeah. Yeah, it's probably not too far away.
Yeah.
I think a lot about the history of Intermountain Healthcare and our organization. We started as 15 hospitals owned and operated by the Church of Jesus Christ of Latter-day Saints. And in 1975, the church decided that running hospitals wasn't core to their mission, even though they had done a tremendous job in meeting that need. But as a religious organization, felt like there was an opportunity to change. And so in 1975, Intermountain Healthcare was created by the LDS Church as a not-for-profit, community-minded and focused organization. And the presiding bishop, Victor Brown, gave us some words of wisdom way back in 1975. And interestingly, our senior leaders use all of this today, constantly. In speaking with us, it's continued to be a compass for our organization, going back to our mission and vision and why we exist. And what Bishop Brown said is, we want you to be a shining light to the nation, become a model healthcare system. And there's no limits on you as an organization now other than those that you place on yourself. And I kind of feel like that applies in a lot of ways to what we're trying to do as a chamber, right? I think we're at this tipping point in our community where there's tremendous growth and prosperity that's on the horizon, but if we're not prescriptive and proactive about how we lead out to meet it, this could be not as great of a place to live in 20 years, because those growth challenges can produce some things that make this a less desirable place. And so I think that's our challenge. And I think if we do it right as a chamber, a lot of those same sort of nuggets of wisdom from Bishop Brown could apply, that we could be a model chamber to the country and to other places that might be experiencing the same type of growth challenges that our community is. And I think we all live here for a lot of the same reasons. We love the access to recreation. It's a tremendous business environment. It's a great place to raise a family. It's safe, it's clean. And we don't want those things to change, right? And so how do we as a chamber lead out and be a shining light in terms of the things that we're doing to make sure that those wonderful growth challenges don't become things that are negative and drive people away from this community.
Yeah. I might just say to our audience here, I took a class at BYU on Excel spreadsheets, and there's a feature called WYSIWYG. And it stands for what you see is what you get. And I feel that way about Kyle. I just to spend a few minutes with him today and just take the time out of your day, and as busy as you are, you really are truly genuine and authentic. And I can see that that's part of your strength in leadership, is just to be who you are and to give of your best self, that you are leading out by example, that you're leading out with empathy. And it probably takes that kind of character and the attributes that you mentioned earlier, excellence, integrity, to be a leader into the next couple of decades. And so for one, Utah Valley Chamber, we're really excited for our partnership together, but most especially to lean on the type of leadership that you're bringing, to give you our vote of confidence as an administrator and the CEO of a hospital that is worthy of its legacy, and to lean on you and to have you carry us into the next several decades. We're very lucky as a community. And Kyle, thank you for your minutes today. Sure appreciate your time.
You bet. Thank you, Curtis.
You bet.